And tonight, doctors at Eisenhower Health say there is a light at the end of the tunnel. They say we're just a few months away from seeing the majority of Americans vaccinated for coronavirus. I spoke today with the Chief Medical Officer, Dr. Alan Williamson, to get the latest. Dr. Williamson, it's great to see you again. Thanks for joining us.
Thank you, Peter. Good to be back.
First off, what's the latest at Eisenhower?
Continues to look very good. We have about 12 to 13 cases per day on average in the hospital. Typically 4 to 5 of those are in the intensive care unit. And that's held really pretty steady for the last 2 weeks, almost 3 weeks now.
Okay. And since we last spoke, Riverside County has now moved into the red tier of reopening. And now we're even looking ahead towards possibly moving into the orange tier. So that means, of course, that more sectors of the economy are going to start reopening. But that also means there's a higher chance for the virus to spread. So I'm curious, what is your take on all this?
Yeah, well, I certainly welcome trying to get back to some sense of normalcy, and I understand everyone's desire to do that as quickly as we can. We need to be safe about it. I think that we are fortunately seeing the impact of vaccination out there. The case numbers and the positivity rate, the number of tests that are turning up positive, all continue to trend downward, which is exactly what we want to see. What we have to watch very carefully is to see if we see that then halt and begin to rise back up again. And then we'll have to be ready to act decisively and be more careful going forward. But at the moment, I think it's reasonable certainly for us to try to relax some of those rules and allow some of the businesses to get back into business. We need to continue, however, to practice our own personal safety measures. So even those of us who've been fully vaccinated, because of the variants that we are seeing out in the community, among other reasons, we still think it's critically important for us to continue to use the public health measures that we've been touting since the beginning of this pandemic, meaning wearing the face mask, washing hands, and continuing to socially distance. I do think we can begin to have some family gatherings. We see again on news reports and so on, the grandparents finally getting to hug their grandkids for the first time in many cases in a year or close to a year. And that's obviously very, very important for our well-being and our mental state.
Absolutely. And speaking of the vaccinations, yesterday county health officials announced that there's actually more supply of the vaccine than demand right now in the county. So I'm curious, are you seeing the same thing at Eisenhower, and what's the latest with vaccination efforts there?
No, we still have much more capacity to vaccinate people than we have vaccine, although this week we are seeing more supplies coming in. So hopefully that is the beginning of a trend that we're going to be able to see more and more vaccine pouring into the valley. We're prepared to give up to 10,000 doses of vaccine per week. We can do almost 2,000 patients a day, 5 days a week. So we are prepared to be able to vaccinate really the vast majority of the Coachella Valley within a matter of only a month or so. But we do need to have the vaccine in order to do that. So I understand what they're saying. There is a little bit of a bottleneck in terms of actual distribution. So shipment of the vaccine is increasing, but trying to actually get it through the system, through the state, into the hands of the hospitals and other vaccination centers that are actually trying to get these into the arms of patients is where we're still seeing a little bit of a bottleneck. But I think it will continue to improve over the coming weeks.
And the AstraZeneca vaccine may soon be approved by the FDA here in the United States. What should we know about that?
So the AstraZeneca vaccine is similar in some ways to the Johnson & Johnson vaccine, but dissimilar from the first two that we had approved here in the United States, meaning the Pfizer and Moderna vaccines. Both of those vaccines use a special way of delivering the material that we want to introduce into the human cells to produce the spike proteins to which we produce antibodies, which is what's leading to the immunity against the virus invading our bodies. The two early vaccines, the Moderna and Pfizer, use a lipid envelope, a fat envelope around this raw material. And because that is not a stable molecule, it's not a stable structure, is why we have to keep those vaccines at such cold temperatures, particularly the Pfizer vaccine at -70 to 90 degrees. The Johnson & Johnson and AstraZeneca vaccines use a benign virus, a virus that comes from other animals that does not cause disease in humans, but it is a carrier for this material to be introduced into the human cell. And because that virus is much more stable, it's a virus, it's used to living in the environment out there, we don't have to have these stored at the extreme temperatures. They can be stored in a refrigerator for up to 6 months. So similar to the flu vaccine, for example. That's going to become much more important worldwide, perhaps, than in the United States, although there's certainly areas in the United States where this has been an issue of getting vaccine into some of the rural areas, for example. They don't have the capacity to have the ultra cold temperature storage. Johnson & Johnson's been able to step up in that scenario for the most part, and even Moderna, where we could use regular freezers to store the vaccine. But when we talk about worldwide vaccination, as we get into third world countries and so on, these more stable vaccines will become critically important. And we need to look beyond our borders. We can't just be concerned about exactly what we're doing here in the United States in terms of vaccination. This is a worldwide pandemic. And as we learn, unfortunately, we don't get to just shut our doors and prevent these viruses from getting into our communities. So it is critical that we also look beyond our borders and look to the world and what we're able to do to get the rest of the world vaccinated as quickly as possible.
Final thoughts on where we stand right now in this pandemic, now that it's been more than a year after we went into lockdown. Is there a light at the end of the tunnel you're seeing?
We are absolutely seeing a light at the end of the tunnel, but we're still not quite all the way out of the tunnel yet. And I think I would echo what I hear many of the other experts saying, and that is, it's all that much more critical that we just hang on a little bit longer. We're probably literally 1 to 2 months away from very substantial improvement in the situation where we will have a significant majority of the population in the United States vaccinated against COVID-19. And then we really can begin to resume life somewhat normally. It's probably not going to return to completely normal yet for a while, but we can get together in groups, smaller groups. We can begin to enjoy activities and dining indoors and so on more safely very soon. We're not quite there today, but we are probably no more than 1 to 2 months at the most before we can really seriously expect to be back to some semblance of normal.
All right. Dr. Williamson, as always, we appreciate your time. Thanks for joining us.
Thank you very much, Peter.